Right here.
Okay.
Good morning, everyone. My name is David Campos. I'm a Deputy County Executive, and I serve as the Public Information Officer for the County of Santa Clara's Emergency Operations Center. We are here today at the headquarters for the county's Emergency Operations Center, and we are going to hear from the county's COVID-19 testing officer, Dr. Marty Fenstersheib, who is going to provide some just general information about all the work that is being done to enhance testing throughout the county, and then we'll be happy to take questions. So with that, Dr. Fenstersheib.
Thank you, David, and it's good to be here today. We have expanded our testing in Santa Clara County, and the reason is because we've moved away from testing just symptomatic people for COVID-19, and we are now looking to make sure that we capture anybody and test them who may have been exposed and who is carrying the virus. So you don't need to have symptoms in order to pass this on to somebody else. You could be what we call asymptomatic or without symptoms and still pass it on. So because of that, we want to make sure that testing is available to everybody at highest risk and then to the general public. And when I say highest risk, I'm talking about people that are on our front line. So first responders and people who are working to make sure that we have everything we need in grocery stores, driving buses, working in pharmacies, that type of thing. So we want to make sure that those people are tested, and on a regular basis. We're recommending that people who are working on those frontline jobs are tested at least every monthly. We've expanded our testing sites to over 46 now, and I wanted to tell you about a couple new ones that we have. We have testing through a mobile unit that is going to the east side of San Jose in a van, and they were already there last week at the end of the week to try it out at the Tropicana shopping center and had a good response. And again, people that are at highest risk came out and got testing, and we're going to be there again this Friday actually at the Tropicana. We're also up in Mountain View, and again, another area that we feel is very important to test people who may be at highest risk. So our mobile van is up there today, and will be up there again on Wednesday. So you can take advantage of that. We also have several other sites that are drive-through sites. And again, all of these, I just want to reiterate one thing, that this testing is free, it's easy, and it's safe. Very important. The type of test that we're doing to actually take the specimen, I've demonstrated in the past, it's just a small nasal swab, not very long, and they basically have you do the test yourself. So you'll take the swab and use it in each side of your nose, and they will have you then put it in a container, and you're done. Again, fast, free, and safe. If you want to find out the testing site closest to you, you can go onto our website to sccfreetest.org. And then you will see all of the testing sites. Just click on one that's nearer to where you live, and a little box will pop up, and it'll give you a phone number where to call. If you don't have internet access, and I guess you do because you're watching this, but if there's somebody that doesn't, they can call 211. That's our information line, and basically ask again the operator on that 211 line for information as to where they should call to get a test. Again, we want to make testing available to everybody at highest risk and to anyone else who wants to be tested for COVID-19. And our numbers are certainly going up right now. I don't have them for you today because all of these sites are just now gearing up to do a lot more testing. We're also including our community health partner clinics, so those will be also available for people to go get tested. And all of those people that have a regular physician a healthcare provider such as Kaiser can actually go to one of those clinics and sites and be tested. We're also, again, looking to test all of the contacts to anybody that was exposed to a known case. So if you were told you were exposed to somebody who actually had COVID-19, then you're a contact. And we want you to go to one of those testing sites and get your free and safe and easy test. So remember the website, seccfreetest.org, and that's where the testing clinics are all laid out, and you can find the one that's closest to you. Okay? I'll stop there and see if there's some questions.
Hi, Doctor. As of Friday, there were some issues where people had logged onto the website and were unable or not allowed to actually book appointments. It didn't matter how far the timeline was extended out. Have those problems, to the best of your knowledge, been resolved? If it's one thing to announce testing, expanded testing in multiple sites, but if you log on as directed and you can't actually make an appointment, it's sort of self-defeating.
Yeah, so the question's about if you log on, can you make an appointment, and are there, have we taken care of any problems that have arisen? First of all, let me just mention, it's a good point, that our mobile sites, the ones that are operating in Mountain View and that will be at the Tropicana, do not require an appointment, so you can just go, and when the van is there, you can go and be tested. Are all of the issues taken care of on the website? We are identifying them every day, and we are trying to put the most up-to-date information, trying to make sure that all of those telephone numbers are working. And are there going to be some problems and glitches? Yes, until we resolve those. But we're working every day. A lot of people are working to try to get all of that ironed out so that we don't have barriers and problems. Because if we tell you that you should go get tested, it should be easy for you to do that. And that's part of what we want to make sure happens.
So, from the testing dashboard online, it looked like the most tests were ever administered within the county since this all began was about 1,900. What do you think is the number? What is the capacity that we really need to have adequate testing so that as we continue to reopen, there's sufficient testing so we don't get too out?
So there's, everyone wants to know about the actual numbers of testing. How many do we have to do to be absolutely sure that it's safe to reopen and whatnot? Yes, there are numbers out there. Let me just say a couple of things about that. First of all, it's not so much how many tests we do. So if we take 1,000 people that have been sheltering in place, that have had no exposure to anybody, and test them, most likely they're all going to be negative, and that doesn't really help us. What helps us is to go to the places where we know we have cases, and we know that people are going to be exposed, and we know that people are working in areas where maybe they can't social distance. So to me, it's more important on focusing on where. Now, there's also the issue of how many tests. We've been trying to get up to we're nearing the state's requirement of 150 tests per 100,000. We're getting close. We've done very well in comparison with the rest of the Bay Area, and so we're getting close to that number, and we want to go beyond that because I think that's just the lower number. Are we there yet? No, we're not there yet, but we've been mobilizing everybody in the community, and as our data comes in, we should see an increase in the number of tests that we are able to do every day.
As we ramp up contact tracing, these mobile units, does it make more sense to figure out if you have a known infection and then everyone that person may have come into contact and encourage them to get tested, or if you can sort of identify pockets of disease, does it make sense to sort of roll those mobile units to where you think the infection is presently spreading?
So the issue, do we go to areas where we know there's going to be high numbers of infected people, and how does that relate to us doing testing for people that have been identified as contacts? I think that's close to what you asked me. Both. The answer is both. Sometimes you may have been exposed, you get infected, and then the people that you came into contact perhaps were all over the place. Maybe you've traveled, maybe you were at your work. So it takes concerted effort really to identify those people and make sure that they are informed and they are then told to go get tested. Again, that will identify pockets of new infections that we can contain and keep under control. The other issue, though, that you brought up is the issue of going into the areas where we know we have high cases and we want to test people because we know their chances of getting infected is much higher. And those are areas that we definitely have that we've identified in the East San Jose area for sure, increased cases there and increased positivity rate. Areas of Mountain View, and that's why we're up there with our mobile unit, and some pockets down in the Gilroy area. That's not the only places where there are infections, but those are levels that are higher than the others. So we need to concentrate on those, but also make sure that every case that's identified, those contacts are identified and sent off to be tested.
Obviously, it's important that people get tested, but how important is the data to your office and county officials? What to do with it, how to interpret it in terms of the test results?
Well, yes, how important is the data? The data is very important because we want to make sure that we've identified the people that have been exposed to cases and to start seeing what that rate is. What is that positivity rate? We want to make sure that we can capture all the people that have been exposed and who are infected and then the contacts. And then as we contain the disease over time, the positivity rate should drop. So that shows us that we are containing the disease. Also, it will also tell us how many people we're testing. And as I said, we want to make sure that we test them in the areas where we know that the highest prevalence or the numbers of cases are there.
What are you finding in terms of asymptomatic positive tests? People that are concerned coming out, getting tested, aren't feeling sick, but yet test positive. What is your experience with that?
I don't have all the data on just asymptomatics, but certainly we have seen, and the question again, what about asymptomatics and the positivity, the chance of being a carrier and not showing any symptoms. If you look at the data around the world, the number is as high as 35% of cases who are infected that show no symptoms. We know that there's also the chance before you develop symptoms, so we'll say pre-symptomatic, meaning that you will develop symptoms, could be as much as 48 hours before you start getting sick and showing symptoms. So two situations, pre-symptomatic, a couple days before you even show symptoms, you may be able to spread it. And also, totally asymptomatic means you're infected and you're not going to show symptoms, but you could still shed the virus. And those numbers, as I said, could be as high as 35%. So again, that's why we are social distancing. That's why we are cautious about making sure that we put on our face coverings when we're out with people so that we are protecting them, they are protecting us, and making sure that we aren't getting exposed to infection.
In a way, if you're getting tested, people tend to think, oh, it's all about me. But are you being responsible by getting tested, such as wearing a mask and social distancing? Is that another way of seeing things?
So again, the question, if we get tested, is it really just all about you, or is it about someone else? And I think it certainly is about you, because you want to make sure that you are staying healthy, but you also are protecting your family, your coworkers, your friends, and the community. So by being tested, you're actually performing a community service to provide information to yourself so that you don't put others at risk. And they, in turn, also get tested to protect you. Again, it's your family. You don't want to bring it home to your family. You don't want to bring infections home. And if you do, though, we want to make sure you get tested so that we can contain that so you don't spread it any further. So this is our whole strategy as we start to open up and as people are out there in public more and more as time goes on, that we can quickly contain any infections. Any little flares or flare-ups in infection, we can contain them, identify the contacts, and then quarantine or isolate those people. Again, this is all about keeping our numbers low, keeping people safe.
What is the value of a negative test result? I've talked to some people that have kind of said, well, we're maintaining social distance from this friend or this family member. we're wondering if we get a test and are negative, can we perhaps, sort of ease some of those restrictions? And the thing that I was thinking was that test is just a snapshot of time. Take that test, you can be negative, you can be exposed the following day. So what for an individual or that individual's group of friends and family, what is the value of a negative test result?
So what's the value of a negative test result? Well, you're right. It's a point in time, and we're basically saying at this moment you are negative. Or if you're positive, again, you would then be isolated and your contacts would be tested. But if you're negative, then you are negative for that point of time. And for that, that's good information, so that if you are at home for that time, you basically say, I am not going to be a risk or put anyone else at risk. But again, if you have continual exposure in the community, you need to be tested on a regular basis. So if you're working in the community, we are basically saying be tested on a monthly basis, because one time is not going to tell you anything more than how you are at that moment. But it's still good information so that you know what you've done up until now has worked. And from that point on, again, you would then do the same type of cautionary measures and then get tested again so that we can continually monitor you to make sure that you stay negative.
Why not bi-monthly or weekly if you're in a section where they're like police officer, firefighter, grocery store clerk? I mean, if these diagnostic tests have value, why not with greater frequency than once a month? A lot can happen in a month.
Right, and so I think the question is, why don't we do them much more often? We're dealing with our capacity right now. We have a large community. We have a lot of people that are potentially at risk. We are saying at this point, do it monthly, no more than every 2 weeks. But right now, as our capacity builds, that's basically what we can handle. I think over time, as capacity increases and the availability of the tests increases and it becomes easier, I think we will probably see people doing testing more often. But that has to do with technology and our capacity. So we'll see what happens as the technology catches up, and we will see how well we can test people on a more regular basis.
Any other question? Okay.
Thank you.
Say something in Spanish, and then we'll wrap it up. Again, thank you, Dr. Fenstersheib. And again, the county is working hard to expand testing capacity. Para las personas que hablan español, mi nombre es David Campos, ejecutivo adjunto del Condado de Santa Clara, y hoy estamos anunciando 6 nuevos sitios para hacer las pruebas de COVID-19. El condado está expandiendo la capacidad de hacer estas pruebas. Queremos que las personas que tengan el peligro de infección, que tengan contacto con el público, que por favor vayan a estos sitios para hacerse la prueba. Tenemos una camioneta van que es móvil, que estará presente en diferentes partes del condado, incluyendo en Mountain View y también el este de San José, donde estarán presentes hoy en Mountain View de las 10 de la mañana a las 2 de la tarde. El miércoles también en Mountain View de las 9 de la mañana a 1 de la tarde. Y en el este de San José, en la placita Tropicana Shopping Center, en el centro de comercio de Tropicana, de 10 de la mañana a 2 de la tarde este viernes, y no necesitan cita para poder hacerse la prueba. Otra vez quisiéramos enfatizar el hecho de que el Condado de Santa Clara está haciendo todo lo posible para asegurarnos que miembros de esta comunidad, de la comunidad latina, puedan tener acceso a hacerse esta prueba. Y estamos trabajando con organizaciones comunitarias para que ustedes puedan recibir esta información. Si tiene alguna pregunta y no tiene acceso a la internet, puede llamar al al 211 para recibir más información acerca de las pruebas que están disponibles a la comunidad. Muchas gracias.